Hello, welcome to another episode of A Conversation with Villa Springfield. I'm Michele Hemphill, and today I'm really excited. We have Dr. Shadid. Did I pronounce that correctly?
That's correct.
Good, great. He is an interventionalist, pain management, and anesthesiologist physician. Welcome.
Thank you.
Tell us a little bit about your practice and what you do here in Springfield.
Definitely very excited about this. I am here in Springfield offering a multidisciplinary interventional pain management. Basically what that means is that pain is an experience that a patient has, but really cannot explain what the origin of the pain is.
Right.
That is the number one reason patients visit their doctors. Many times it is surgical, other times it is non-surgical. When it comes to back pain or spine-related issues, majority of the times in the past, patients end up getting surgeries. Interventional pain management is something in between where the pain is diagnosed and patient is taken to surgery. We alleviate the pain by managing symptoms, understanding where the pain is coming from, and avoiding surgery. That doesn't mean that every patient that walks in is going to be a non-surgical candidate.
Sure.
But majority of the time, what we have found and what we have learned over the years, evidence-based medicine tells us that spinal surgery is 50-50 when it comes to success. So we have to then look for other options.
Right.
And majority of our patients are managed and the pain is alleviated or at least managed so that they can perform their daily activities with ease without being under the knife.
Right. And no one wants to have surgery. You know, that's a scary situation anyway, let alone on your spine.
Correct.
So I would think pain management would be what you would seek out. I would think surgery would be a last resort.
Absolutely. So this is how I try to explain to the patients in a more layman terms.
Mm-hmm.
If you have chest pain, one is always worried about having a heart attack.
Right.
But nobody wants to have heart surgery.
Right.
And now we know that majority of the people don't end up getting heart surgery, but instead get stents or other intervention by a cardiologist. So think of me and think of interventional pain management as the cardiology of spine surgery.
That makes sense. Yes. Now, pain management doctors sometimes have not gotten the best, let's say, publicity over the years. But it's come a long way, hasn't it?
Absolutely. So the pendulum with regards to opiate use, and
right.
this is always hinged around the opiate use, the pendulum has swung both ways. It used to be an understanding in the past, not too long ago, about 10 years ago, that pain was the next vital sign. And we were pushed and forced with an invisible hand that we have to treat patients' pain no matter how much we prescribe for the pain.
Right, the amount of prescription
and
they would need.
Exactly. And that translated into being heavy-handed with opiate prescriptions in the community, and patients' expectation was that they would walk in and walk out with whatever is required or requested. However, we have now understood over the many years of experience and research that that is not the right way to treat pain patients. However, providers or physicians that were managing pain patients 10 or 20 years ago did not have that data available.
Right.
So that is the reason. And then there are other socioeconomic issues that surface that are related with these issues that have plagued our society. But unfortunately, that was a combination of not knowing, not having enough evidence, and patients' wrong expectations.
Right.
But we have come a long way.
Yes, that's great. Because basically, medication's just kind of like a Band-Aid. They're just trying to mask, or it just masks what's going on usually, doesn't it?
Absolutely. Now, we cannot, so medication definitely has its role in pain management. Acute pain management after surgery, we definitely use very strong pain medication. There are some conditions where we have to use pain management modalities along with pain medications to really control and make the pain manageable. But to say that pain management is equivalent to prescribing opiates is a wrong
perception. Right. We're in a pandemic.
Right.
Everyone knows it's driving everyone crazy. You do telehealth?
Absolutely. So, short of needing to see the patient face to face for a specific physical examination or to do an intervention in an operating room or procedure, we can offer, and we do offer, our services over telehealth and television.
That's great. And if they would have to come to the office, I'm sure it's very safe.
So we exercise all the precautions that are mandated, and we try to go above and beyond because safety is first.
Right.
The health of the doctors, myself, my employees, and patients is equally important.
Right.
Because we do not want to risk it.
Right.
So we definitely exercise social distancing as much as possible.
Like we are here.
Exactly. But when it comes to doing a physical examination, then I do take that risk.
Sure.
But using the protective gear, I will examine the patient. If I need to have a face-to-face conversation, if I need to consult the patient, yes, definitely we'll do that. Otherwise, we use cameras even in the house.
Really?
Yes.
Gosh, that's great. I think there's just been a lack of confidence with everybody, no matter what type of physician or the hospital, wherever it is, in going near anything medical because we're afraid we're going to catch the virus. You know.
That's absolutely true, and it is a fear based on legitimate concern.
Sure.
However, the assurance has to be given to the patients that we are doing everything we can.
That's right.
Because
That's right.
in it, we're not jeopardizing patients alone. If we were to jeopardize,
right,
we are taking the precautions to be safe for ourselves, our staff, and patients.
And your families.
Absolutely.
I mean, we all have families we go home to, and people we see outside of our daily job that you have to be aware of.
Correct.
So tell me a typical patient. Is it a back pain or walk me through what would happen if I came to see you and I had back issues?
So back pain is very complex,
right?
And there is no family that is not afflicted by it.
That's right. We abuse our bodies.
Exactly. in this modern day lifestyle, either we overuse or underuse our bodies, and the way it was designed by the Almighty was not for either extreme.
Right.
So when we do that, we tend to overload the joints, and God has put many joints in our spine.
Right.
And when those joints are not happy, pain is what is perceived, whether that is the joint of the disc or whether that is the joint of other parts of the spine. Then it is my job to evaluate the patient and do certain tests to figure out where that pain is coming from and offer an appropriate treatment procedure to give the patient an opportunity to rehab the back, because eventually, as a physician, we are to rehab the body.
Right.
We're to help the patients rehab the body. We're not really successful in putting new things in other than knee joints.
Sure.
We have not been so far. The medicine has not offered that big of a success. So what we do is we offer options where those joints that are achy can be calmed down, and appropriate rehab and back to normalcy of the back can be achieved by the patient.
And I would assume it's like a multidisciplinary kind of group effort.
So think of it this way: if a back pain patient comes, our typical regimen will include, first of all, understanding is the pain causing psychological dysfunction.
Sure.
Because a nagging child for 15 minutes can really make you irritated,
especially during a pandemic.
Right. And then on top of it, if you have pain for years and years,
right,
it definitely plays a havoc on patient's psyche. Many times, if we do not address the psyche and we only treat the pain, we're really doing disservice to the patient. So every patient who comes in at least sees a pain psychologist once.
Right.
So that's the first thing. Second thing what we do is we try to rehab the patient with the help of physical therapy as soon as we can. When pain is under control, whether that is medications, injections, procedures, or a combination. And this would be sort of the trajectory of the patient who is coming in for back pain.
That's great. And I love to hear the psyche part of it, because how depressing. You know, nobody wants to be in pain every day, all day, and it does wear on you.
Absolutely. And then not to forget those patients who have baseline psychological issues.
Right.
Pain is perceived absolutely as a terrible perception. It might be of the same amount that another person perceives it normally and can manage.
Right.
Patients who have depression or anxiety to begin with will not manage the pain very well.
That's right. And it's a vicious cycle, because then you just don't do anything.
Right.
You know, you're just at home, and I would think right now with us staying home more, that people who don't have a high pain tolerance or have something else going on, it's just magnified.
Absolutely. And this is the worst thing one can do, where if our joints are hurting and we let our muscles become weaker, which are the supporting elements.
Right.
So for a pain patient to be inactive is the worst scenario that can be created. However, this pandemic, that has been unfortunately the case. It has worsened the psychological issues of patients as well.
Right.
We see misuse and abuse of medications. Not to blame the patient. But
but you do what you can do.
Exactly. And that is why we have to deliver health care to these patients no matter what.
Right.
And that's why where telehealth comes in. It's a very important aspect.
That's fabulous. So if I wanted to come see you, what's the address? Where are you seeing patients at?
So right now I'm at 200 Medical Center Drive, which is adjacent building to the hospital.
Okay, it's right on the hospital campus.
Exactly. It's the medical office building right next to the emergency room.
Right, where the Community Foundation is.
It's in Community Foundation, second floor.
Oh, that's great. Yeah. That's great. And to call you, do you know the number offhand?
Yes.
Or,
937-280-4970.
Okay.
Call to make an appointment. It would be easier for me if I can review the medical records, if there is any imaging associated with it.
Oh, okay.
But if you're hurting or suffering from back pain,
right.
Appropriate MRI, X-rays.
Anything they've had done up to this point.
Any treatment that is done, if we have those medical records beforehand, I can review it and have a meaningful conversation and evaluation.
When you see them.
Right.
That's great. Now, as far as like their primary care docs, do you work with them, or if you need to know more things, do you communicate with the primary care physician, or if they ask you to, would you do that? Or
absolutely, I prefer actually texting back and forth.
Sure.
And that's what I do with the majority of my referring physicians, because that is the only way we can deliver comprehensive care to the patients.
Right, everybody needs to know what's going on.
Exactly. And secondly, and most importantly, primary care physicians are the captains of the ship. Right. They are the ones who are dealing with every aspect of the patient. And every single time we see the patient, the note that I write is faxed back to the referring physician.
That's great. I love to hear that, because, you know, I'm in short-term rehab, long-term care, and sometimes we get patients from the hospital, and they can't communicate well, and we don't even know who their primary care doc is, because the hospital is send them to the facility.
Right.
And it becomes a problem, because you want to make sure the right medication's given and whatever their history is,
right.
You know.
And the other thing that is a spin-off of this, if a patient comes in and we do not have appropriate medical records and history, and we have to then start digging, the patient sits there for an hour, 2 hours, and it is perceived as if we are taking a long time.
Right.
And they don't. It affects their experience of their visits to pain management doctors, specifically in my scenario. So if you want to avoid that as a patient, if you want to have a good experience, walk in and out and have meaningful conversation and appropriate direction for your pain management, if you can facilitate all the appropriate medical records before coming in, it will be really beneficial for you.
That's great. Yeah, just come armed with your information, and
Right.
It'll be better for everybody.
Right. Right.
Well, that's wonderful. And is there a certain age group that you see, or do you see any age, or do you?
So there's no, pain doesn't see any,
Right.
There's no age discrimination when it comes to pain, and definitely we are there to treat all ages.
That's great.
Although pain complaints are majority of the time and are the causes are aging bodies.
Exactly.
Pretty much.
It's not pretty.
Correct. Pretty much in this society, we see that a large percentage of our aging population suffers from low back pain, and it is at the expense of something called spinal stenosis,
Right.
which has been up till now traditionally treated with a major spine surgery, where the surgeon has to take parts of the bone off, because the spinal stenosis means that the spine is being crushed.
Oh, and that's where the pain is.
That's why the pain is coming.
Yeah.
So imagine if the spinal cord or the nerves are being crushed, then we have to alleviate that pressure by taking the bone off. And once you take the bone off, you've taken the supporting element. Then you have to put screws and rods.
Oh.
And you hear patients who are not doing very well because they have gone through this
Right.
surgery. Not to say that that is not necessary in
Some
many
people.
cases.
Sure.
But majority of the patients, I as an interventional pain specialist can offer minimally invasive procedures where I can treat the spinal stenosis with either doing minimally invasive lumbar decompression or other modalities,
Sure.
where they don't have to go through the surgery.
That's great. I have enjoyed talking to you so much, and I've learned so much, and right off the top of my head, I have a niece that I think I'll be having call you, who's fought with her back forever.
Absolutely.
And it, it wears on you. It's hard.
Figure.
Yeah, that would be great. Well, thank you very much. I really appreciate it. His information's up on the screen. You can give a call. You can get an appointment. Again, thanks. Stay safe.
Thank you for having me.
Yes, thank you for being in Springfield. We appreciate it. We can use you. Everybody has something, unfortunately.
Unfortunately.
And thanks for tuning in. And until next time, we'll see you later.